like to welcome you. I'm going to be the moderator tonight. My name is Barb Ireland. The League of Women Voters, in a partnership with the Colorado Foundation for Healthcare, Universal Healthcare, and NOCOM Now, Northern Colorado Now, is sponsoring this program of improved Medicare for all. And we're kind of concentrating on the experiences of small business owners and what an advantage it would be to them to have Medicare for all for their employees. So this is the agenda that we're going to follow. We are going to first show the film Fix It, Healthcare at a Tipping Point, and it may be even more at a tipping point after this recent weekend. It's 38 minutes long. It was produced by Richard Master, who is the CEO of MCS Industries, because of his concern about the rising healthcare costs for his employees year after year. So he produced this movie. Following that, we will have questions and comments led by Dr. Glenn Pearson. We're very happy to have him with us tonight. And then we have a panel of small business owners, 3 of them, who will speak about their experiences, and that will be followed up by questions from the audience. Now, I would like to introduce Dr. Glenn Pearson, who is going to comment on the movie, and you can ask questions from the audience. He is an expert on the single-payer system. He has spent 35 years as a physician, as a psychiatrist. He moved to Fort Collins in 2001, and he's been at Poudre Valley Hospital ever since. He is the past national president of Physicians for a National Health Program, an organization whose sole purpose is to promote a Medicare for all system for the United States. Glenn.
Thank you. Thank you. So I don't think I'll do too long of comments, so be thinking of your questions. One of the things I like to say is, because they're talking about, they added it up to like $770 billion a year that we would save, and then to help the uninsured, the underinsured, and can't remember the third part, that costs some extra money. So if you thought of it, that first year you're saving about $500 billion. Another thing that when PNHP has put forth bills, we also put in about $100 billion to retrain people. Many of my nursing friends still work in the health industry. They just work in administration. So I always say we include $100 billion in there so that people can get retrained and actually then go help people instead of figuring out either how to deny care or how to get paid or whatever. But that's the first year savings. So sometime I'd ask all of you to look at the difference in cost of Canada versus the United States when Canada did single payer. It's called Medicare there in 1970. So if you look in the first couple of years, they saved money just like the movie shows, but 10 years later, then they're about half of our cost. So you save $500 billion a year the first year, but 10 years out, you'd save about $1 trillion per year because the savings keep adding up. And so sticking with the economic theme, does anybody know how the federal budget is doing the next 10 years? What's the predictions? The predictions are that we're going to be about $10 trillion more in debt to China and everyone else. And how much does that add up to per man, woman, and child? I was trying to find out, we're always a bit of a middle-aged crowd. Does anybody have children still in school? Or just family of 4, maybe? We'll just pretend that she has a family of 4. She said she has children. So, so the extra $10 trillion that we're going to be spending, remember we would save $1 trillion a year if we switched to single payer. So the extra $10 trillion that we're going to be borrowing from China adds up to $33,000 per every man, woman, and child in America. So a family of 4, that would be almost $140,000 that our country will be in debt and eventually have to pay much of that back for an average family of 4 who's making maybe $60,000 a year. That'll be an extra $140,000 in debt. That's just the next 10 years. That's not going any farther out. A couple of other economic ones I'd say is America is the only modern nation where people stay in their job just for benefits. So it's estimated that about 1 in 6 Americans, now some of you guys are retired, but whoever's not retired, is anybody staying in their job for benefits? See, I think we have a fair number of retired. So I'll raise my hand because 5 years ago I was planning to retire, turning 62. I was going to retire at 62. But because I've had cancer and my wife's health issues, and it's unclear what's going to happen with health insurance in this country, currently there's Obamacare and things, but it's unclear whether that will last. So I'm actually going to keep working at PVH till I'm 66, really solely to get health insurance. Our health system is killing American business. So on average, we think it costs about an extra $1,500 to produce a car in the United States versus Mexico or Canada for health insurance alone. And so if you think of that, when you're going to the dealership to buy your $25,000 car and you get it for $1,500 less, well, gee, you know, that hurts American business. And that's those same businesses trying to sell goods to Germany and wherever. When you're trying to sell goods overseas, you have to add in those healthcare costs to the price of your product. The other is that if you're a small business, it certainly must make it harder to attract people, because one of the reasons I work for PVH is because it's a giant employer and has good health insurance. And it's one of the reasons I don't go and form a small private practice. I'll just do 2 comments of patients I see today. Back when I started on this issue 30 years ago, I used to always tell audiences that every single day I see people that are harmed by our health system. And now it's similar, except I'd say every single person that I see each day at Poudre Valley Hospital is harmed by our health system. So I'll give you 2 examples. So one woman who has a very serious neurologic issue, the only treatment center available is in Boulder, but her insurance won't cover it. So she is not going to get the treatment. I just talked to her husband today. She is not going to get the treatment. They're just going to give up. Her quality of life is horrible. It's just not going to change. The second one was a man who his wife has been trying to take care of him at home, but he's had strokes, etc. And the physical therapists at Poudre Valley Hospital say that he is a 2-person assist. So when you're in Poudre Valley Hospital, we won't allow 1 person to help him. It has to be 2 so nobody hurts their back. He lives at home with his wife. They're alone. For the past 2 months, she's been overwhelmed. Both of them are okay if he would go to a nursing home because he's okay with the idea of having the help and she's overwhelmed, but he has no insurance to cover it. So that'd be $7,000 a year, and neither one of them is willing to pay that. That would take away all the money they had to give to the grandkids. So that's, and if I don't have the greatest memory, but if I named the other people I saw today, I'd be able to tell you reasons why they're also harmed. That's mostly what I was going to say, just to give you a few examples so it's not comprehensive. The summary that I always say is that America, it's a moral reason, it's a medical reason, and an economic reason. You know, it's a shame, our current health system. Medically, it makes no sense and people are harmed, and economically, it kills our businesses. Questions and things. Who has? Well, they'd have to have the money. You can't just go to Canada and not be a Canadian citizen and get treated. If it was an emergency, if you were in Canada and you had lousy American insurance, which many people do, and then you have a heart attack there, they will treat you. And normally, historically, they would either give you a very small bill and things like that, but of course they have to pay for their health system too. So no, they can't just. That'd be like they'd have to build a wall, between Canada and the United States. So 2 questions. So I'll do the simple one first. Does Canada have private supplemental insurance? Historically, it's been illegal to buy health insurance in Canada that duplicates the national system. So you could get insurance that gives you a private room in the hospital or something like that, but you would not be able to get private insurance that means you get to jump the queue. The second question she asked was, is part of the issue in the United States lobbying and things? Yes. So, it's a $3 trillion system. The system makes one extra $1 trillion per year, which is $3,000 for every single man, woman, and child in America. Every single year, the health system takes extra. If we actually reformed healthcare, the health system would lose all of that money, which means physicians, hospitals, drug companies, etc. And so in our country, those organizations, drug companies, hospitals, physician organizations, all give money to Congress people and pay lobbyists. And the lobbyists, somebody maybe knows, but the lobbyists outnumber Congress people in Washington, D.C. like 5-1 or something. And so it'd be very hard. You have to have a large amount of Americans shouting angrily that we want this, because you have to fight off the money. And that's why you do things like this. We're meeting here. And the things that I would ask you to do when you leave here is any job, any organization, any club, any church, ask speakers like me or a video like this, because the only way we're going to get a new system, a healthy system, a single payer system, a Medicare for all, is if we get enough Americans knowledgeable to then yell at their Congress people, because in the other ear is all the money.
We're going to have to...
Oh, thank you.
Thank you very much, Dr. Pearson. He really is an expert. If you want to know anything about single payer, ask him. We are now going to have a panel of small business owners. There are 3 of them, and they are going to be talking about their experiences with their employees in covering them with health insurance, and what if there's an advantage to them of Medicare for all, and if so, if they believe that, what would they do to promote it? What's the best argument to use? So the first panel member is Carolyn Reed. Carolyn is the owner of 7 Silver Mine Sub restaurants, all the way from Cheyenne to Denver, 1 in Fort Collins, with about 100 employees. And she's a Colorado native who worked for UPS for 20 years before her career as a restaurateur for the last 11 years. And importantly, she serves as the director of the Poudre School District Board of Education. So Carolyn.
I recently was able to offer insurance to my employees, or I should say I was required to, because I had enough full-time employees that under the Affordable Care Act, I was required to provide insurance policies for my employees. So I pay $175 per employee that's eligible for insurance, and then they have to pick up the rest of it. That was cost prohibitive for a lot of my employees. I have 100 employees, 30 of them were eligible for insurance, and out of those 30 employees, only 5 opted to have health insurance coverage. It was hard for me to see, because I was willing to pay more than half, but my employees could not come up with the difference. So even if you have an employer who's like me, who will scrape the bottom of the barrel and forego some of my profits to make sure that my employees have coverage, they couldn't even afford their part. So it's very difficult. I do pay for all of their dental coverage, which wasn't very much, but health insurance for them, when they're only making $10 an hour, $10 an hour for entry level in shops, that's really hard for them to afford that. So I think that a single payer system, like we were talking about here, makes it easy. I pay part of it, they pay part of it. It's based on their income, and I think it'll be a much more efficient system. And so that's what I think the advantages will be for me, is that I won't have to be in the insurance business. I won't have to every month look to see how many employees that I have are eligible, sit down with them, try to talk them into it. I think if I paid all of my insurance for my employees, they would all take insurance, of course, but I can't afford that. It's $350 a month for very basic coverage. My employees have a $6,500 deductible. I have the same exact policy my employees have, by the way. I don't have a better policy than I offer for my employees. That's the same policy that I have. So I think that if we could get those costs down, and if that could come out of their payroll as a tax, it would be much more palatable for them. And so they had asked me what arguments were persuasive for adoption of this, and I think that the fact that it will lower cost for me, and it levels the playing field too. A few years ago, I raised all of my employees up to $10.10 an hour starting wage, back when the minimum wage was, I think, $7-something an hour. I raised them up because I thought that if I gave them a living wage, that it would be better for me because they would be more loyal to me, and that it provide stability for them. But what happens is if I'm raising up my prices for my food, and I'm raising up my, so I can raise up the amount of money I'm paying my employees, it makes for an unlevel playing field with my competition who might not be as concerned about their employees. So I think that when you have insurance like this, everybody has to pay in. It levels the playing field for the businesses. And they asked if there are any observations you can make regarding challenges for the healthcare and businesses. And I think just the biggest thing for us, I think you're going to hear it from everybody up here, is it's so expensive. We get so little for the amount of money that we pay. So my husband and I, who I said have the same insurance as our employees, we pay about $360 a month each. We have a $6,500 deductible on our insurance. So this year I had to have ankle replacement surgery. So I have a brand new ankle thanks to the Swedes. But the cost of getting that new ankle was just about exactly $6,500. The irony of it was not wasted on me, believe me. So I think that, so even though I had spent all that money and have spent all that money for years and not used my insurance, when I needed it the most, it still wasn't there for me. So I am very much in favor of a policy that pays for all the care that you get. I think, according to the film, that the efficiencies of this system will make it better for all of my employees and for me.
We'll save questions for our panels until we're done with the three. So our second panel member is Jackie Marsh. Jackie, will you come up? She's from Loveland. Jackie Marsh is a longtime believer in women's equality. She runs the Rabesque Design Company, a boutique gallery in downtown Loveland. And she also owns the building, this old historic building, for a number of years. She became a competitive runner at the age of 17, winning the world's first women's distance race, a mini marathon in New York City's Central Park in 1972. In 1984, she was forced to retire from running after she was diagnosed with a debilitating heart condition.
In 1982, I was training to hopefully get a berth on the first Olympic team for women's marathon. I was training for a marathon, which I ran, but a week before I got the flu. Went ahead and ran the marathon anyway. Didn't get quite as fast of a time as I thought I would. But 2 weeks later, well, it went on for about 6 months. I couldn't walk up a flight of stairs. I got a disease called cardiomyopathy. Turns out it runs in my family, both sides. It took about 1.5 years to diagnose me because no doctors looked at my heart. I was a runner, active, in theory healthy. Got my first pacemaker in '84. And they told me I'd be dead in 2 years. And statistically, that was pretty correct at the time. 80% of the people are dead within 5. And it had taken 1.5 years to diagnose me. That changed my life. Healthcare ruled my life from 1984 until the Affordable Care Act passed. You're talking about staying employed to have health insurance. I had to be employed with an employer that offered group health insurance. It was life and death for me. If I were not married to somebody who had health insurance, I had to be working for a large employer. So for me, the Affordable Care Act passing for the first time in my adult life really afforded me the chance to actually ask myself, what would I, Jackie Marsh, a human being, like to do with my life? And I had gotten into making jewelry, and I decided to open Robust Designs on 4th Street. That was unimaginable to me for the last 30 years, that I could actually set my own course for life. And while I greatly appreciate that I can buy insurance, it is about $900 a month with a deductible of about $6,500, which I used all of last year when I had a knee replacement. So I appreciate that I can buy it. When you have a pre-existing condition and they tell you no, 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 being able to buy it was life-changing, but I can't afford it. And as a small business owner, I have I have a full-time employee and some part-time employees. I try to pay a living wage, so it's between 15 and 17 an hour. One employee makes about $35,000, but she can't afford to buy it, and I can't afford to buy it for her. So we need to do something. In my background, I was a purchasing director for a large software company, and I can tell you the clout you have when you combine your purchasing. When I took over the department, we had offices throughout the country, and each office bought separately. We had different people arranging their travel, buying furniture, buying file cabinets, buying office supplies, and I combined those. It took me several years to combine all the purchasing, but we got our travel costs down. We saved millions in travel. We got our office furniture prices down. Clout, even as a small business owner, when I go to order leggings or skirts, if I'm ordering 10, I'm going to pay a high price. If I'm ordering 100, it's going to get cheaper. If you combine the millions of people living in the United States, our cost will be a fraction of what it costs to just insure part of the people. I've seen it in my own life. I've seen it in small business and big business. You combine your clout and you will save money. And we need to do that. People shouldn't have to do what I've had to do to stay alive the last 33 years.
Thank you, Jackie. Our third panel member is Nora Hill. Nora, will you come up? Nora is the owner of Kilwin's Chocolates and Ice Cream in Old Town, Fort Collins. After 25 years working as a geologist, she thought it would be a lot more fun to own an ice cream shop. Kilwin's has all things sweet: hand-paddled fudge, homemade caramel, and original recipe ice cream.
The burden right now is on small businesses. I pay this year, including premiums paid through the end of the year, which aren't paid yet, I will have paid, assuming nothing else happens to me. I'm an incredibly healthy person, but I had one biopsy and a thing taken off my foot. That's all I've had done this year, and it's going to be $12,000. I pay $8,000 in premium, about $3,000 in a deductible, and the rest was, copays, these copays, which are significant. It's not trivial amounts of money, and that's just for a biopsy. And once the biopsy was done, and I realized that, here I am. I just satisfied my deductible. Great. Now what else are we going to do? So, my toe hurts. Maybe I'll find out what's wrong with that. Get that fixed. So I tried to cram in a bunch of stuff this year, which is ridiculous. Next year, I probably won't even go to the doctor, because if nothing goes wrong, there's no point in going to the doctor if you have a $3,000 deductible. I could go for a wellness checkup, but I assume you all have had wellness checkups. They're, wham, bam, you're still alive, see you later. And it doesn't really inspire a person to want to go back in. My employees, I have 14 employees, and I don't pay health insurance for any of them because I don't have to, which is a crying shame. And what I don't understand is why health insurance should be coupled to employment. The last thing, when you lose your job, then you lose your health insurance? I mean, what's the sense in that? It seems like kicking someone while they're down to me. And it doesn't make sense. I've been lobbying, I've been to Washington, I've been concerned about this for 10 years because I didn't pay any attention before because my employer dealt with it. And it doesn't make any sense that they're coupled, and I don't feel like health insurance is any of my business in terms of my employees, that my employees' health insurance is any of my business. Their health is my business. But giving them health insurance isn't going to do it because they're going to have a $3,000 deductible. And granted, they aren't going to pay $8,000 a year in premiums because they're young. But the burden is, and increasingly, as the administration is saying, more and more cost is going to be borne by people 50 to 65. Thank you very much. I now pay $8,000. So what am I going to pay next year? I think they're estimating that it's going to go up 33% in Colorado. And, you know, what do? I have bare bones. There's nothing else I can cut. My employees, I don't know exactly what they're doing. I ask, and most of them are covered by their parents' insurance because they're really young. And the few who aren't, I try to pay them enough so that they can buy insurance, and I know their premiums are going to be a lot lower than mine, but my belief is they probably don't have insurance. If they get in an accident, well, you know, I'm probably going to be out an employee, and you all are going to be getting to pay for it on Medicaid or whatever the backup is going to be. I don't really have how this would benefit me. Oh God, immensely, immensely. Why should I I feel for Carolyn about being a healthcare administrator. That's another reason I don't pay my employees health insurance, is because I don't want to be a healthcare administrator. That doesn't have anything to do with selling candy. I'm not really in the health business, per se. Having the ability, understanding for myself, I'd like to save that money. I mean, I can afford this ridiculous amount of money I'm paying for almost nothing, but I don't think it's right that I'm paying that much money. And it's only going to get worse in the next, let's see, I get to retire. I get to go on Medicare in 8 years. So that would make it better. But I believe that decoupling and all the things they talked about in the film only makes sense. And I have no idea how to convince people that this is the right thing to do, because there doesn't seem to be any listening going on. The man who talked about being a conservative or a conservative person, his politics being conservative, the Canadian man who's bald, how does it fit in this country to have conservative ideals and to be pissing away money like this on corporate profit? Is what we're pissing away money on is corporate profit. A lot of people will lose jobs, healthcare people who are employed by all this redundant healthcare we have, but there's got to be a better way than having redundant employees, nurses who full-time fill out healthcare forms and then leave the rest of the hassle up to the individual. I mean, just this biopsy, I'm still hassling with Kaiser over them not wanting, they've just messed up the paperwork, and so they keep sending me bills. And then they say, I call them and they say, oh yeah, you don't owe that. And then collection notices. And then I call them and they say, oh yeah, you don't owe that. Not having that would be an improvement. I think that's all I have to say.
How do you answer the question of socialized medicine?
Medicare for all or single payer is not socialized medicine. You could call it socialized insurance, which is similar to Social Security. Social Security is socialized retirement. We all pay into it and we all get it back. So Medicare for all single payer would mean the government would have the health insurance, but the physicians and hospitals and clinics would all be private. The other thing that I would say is that Americans don't realize, but we have a much more quasi-socialized system here than they do in Canada. The great majority of physicians in Canada, just like the ones you saw there, the one woman that worked in Oakland and then went up to Canada, she works in a private clinic on her own. I don't. I'm a salaried employee of a giant healthcare conglomerate. The great majority of physicians in America work for giant organizations, Kaiser. So we are not private, free market, independent physicians. We're all under the wing of a giant corporation. So not only is single payer not socialized medicine, but if we went to single payer, people like me might get out of University of Colorado Health and actually go do what I would want, open up my own clinic. So the question is about queues, waiting times, rationing in Canada and other countries compared to the United States. So in every single country, there's rationing. So to give you an example, my daughter needs to see a dermatologist. I called in August. They said the first appointment was in January. Wow. So that's called rationing. That's called queuing. And one of the reasons is because dermatologists make a huge amount of money in this country doing Botox and other kinds of things like that, and they don't make very much money from acne. So essentially, we get queued. If you want to pay privately and go do that, the dermatologist would love to see you, or maybe to take off your basal cell cancers because they get paid a lot for that. But if you just need a regular appointment, you get rationed. So every single country has rationing. It's very clear that America has the worst. So in Canada, if you have a heart attack, if you have cancer, if you have some very big need, you will get in right away. And for regular routine kinds of things, you can get in very fast. Another example, another patient I saw today who is 5 weeks postpartum, has a horrible postpartum depression, totally not functioning, cannot get into her primary care clinic until the second week of November. So she will see no clinician. She was in the hospital because of this. So anyway, so the short answer is that there's queuing everywhere. So if you needed your knee done in Canada, you might wait 9 months, where in America you might wait only 2 months. So then you're in pain for an extra half a year. But anything you truly need, you would get fast in Canada. And in America, you saw up there 1/3 of Americans delay or do not get care, mainly because of cost, but it's not only because of cost. So anyway, sorry, long answer. Okay. Put that in here that he's a retired family physician, and he's wondering, what are the polls of physicians in America who are actually in favor of Medicare for all and who are not. So if you look at 2/3 of family docs, pediatricians, psychiatrists, almost that many general surgeons, all are in favor of single payer, Medicare for all, national health insurance. But a majority of specialists are against. And the big money in America is specialists, and that's where the money goes to Congress. So if you looked at the top 10 providers of money to Congress, psychiatrists and family docs are not in there. It's the American Medical Association, which is mainly specialists and other highly specialized, very lucrative physicians. And now I do want to say one thing, because I am almost never on a panel with business owners. So has anybody else had issues running a business, being an employee? Because I would love to get their input.
Carolyn, you're on the Board of Education for Poudre School District. Will you tell us about what the issues are with healthcare for the teachers?
Poudre School District is a self-insured, so we're self-insured. So we insure our employees to our own pool, and that is a huge expense to Poudre School District. So that affects teacher salaries. So last year, I think teachers got like a 2% raise, and I think the year before that, they got like 1%. Teachers in Poudre School District start out at about $35,000 a year. The money that we spend right now on benefits for our teachers, if we could lower that down, we could afford to raise wages for our teachers if we could get that healthcare cost coverage down. And so that's a big expense to taxpayers, all right? And it's a big expense to our teachers too, because we have to ask them to accept 1% because we might need to put 3% towards 3% more towards their health insurance in a year.
Someone's asking because it just shows you how much waste there is. So remember, 1/3 of every single healthcare dollar is spent on paperwork and bureaucracy. It doesn't provide any healthcare whatsoever. So if you were able to cut that in half, which every other country does, out of $3 trillion, that saves you about $200 billion a year just right there alone. Be a payroll tax. I mean, you could do it in other ways. You could do a sales tax or something, but in general, I would guess it would be a payroll tax. Be like your Medicare tax, except your Medicare tax would be larger, the one that comes out of your payroll, and then it would cover all 320 million Americans.
You are getting a lower salary for those who are working because your employer has to cover your health insurance.
You're wondering how it would all work, but so you can't, Congress would have to enact this, or let's say if it was on the state level, Colorado or Massachusetts or somewhere else would have to enact it. And they could choose different ways to have the taxes. It does not have to be a payroll tax. That's just a very efficient way to do things. And we already have it in place. You know, there's already a Medicare tax and a Social Security tax, so that would be a logical way to do it.
Okay, so you want to know what kind of peace of mind would this give us if we didn't have to think about this? So for me, it would be not having to search every year for a cheap policy for my employees, not having to every month look to see who's eligible, right? Because everybody's going to be eligible. I don't have to worry that one of my employees fell off because he worked less than 32 hours in the past 60 days. So it takes all of that onus off of me and all of that worry off of me and all of that administrative cost off of me. But just so, I thought of something after I had told you about my experiences, is that when I left UPS, I left a platinum plan that I didn't pay for. And I had that for 20 years, and I had no idea what it was going to be like when I became an entrepreneur. I had no idea. So after I quit to start running my businesses, my husband had insurance, and then he quit to help run our businesses as we grew. So when that happened and COBRA ran out, I was uninsurable. Like you, I couldn't afford insurance. I couldn't get insurance. I had to wait till the state exchange opened to get insurance. So I was without insurance for 2 years because I was considered uninsurable. So that took a lot of grit, and I can tell you that was a really scary time for us because we could have lost everything if we'd had an accident. But I've heard everybody here talk about how great it is if you don't have to worry about insurance. We're portable. If your insurance is portable, it goes with you wherever you are, right? No matter who you're working for. And so that, I can see that as a great advantage for even people like me who are entrepreneurs who want to strike out and start their own businesses.
Yeah.
I believe the city itself is self-insured. Yeah, and I actually think that makes sense for companies that have a lot of employees. You take the risk that you're going to have a lot of claims one year, but I think overall they save money. And I'm a big believer in preventative medicine. I don't, when you're talking about people not having insurance, that also means they're not getting screenings for, pap smears, mammograms, prostate. You wait until you can't ignore it anymore. And that costs society a lot more money. When you're talking, somebody was asking about peace of mind. In 2003, they upgraded me to a biventricular pacemaker. So with the previous pacemaker, I was still only pumping 30% of my blood. So I was very close to being put on a transplant list. So in December of 2003, they put me on a biventricular. Thank you. A short time later, I found out I was going to be a grandmother. My son and daughter-in-law had been married about 8 years. I had given up. And so all of a sudden, I have a new pacemaker, and I should have 5 or 6 years to live. And I have a granddaughter. I had stayed in a marriage that was unhappy for over a decade to stay insured. Yes, exactly. So now I have this little person coming into my life, and I have a great respect for life because I was told at a fairly young age I had 2 years to live, and I should make arrangements for somebody else to take care of my child and things like this. So I have a granddaughter coming, and I elected to leave the safety of a marriage to move to Utah to be a grandmother with the full expectation that I would die in 5 or 6 years, 7 years when my pacemaker battery ran out. So my life has been kind of an odyssey, but I was willing to do that to experience being a grandmother. So peace of mind of knowing you have insurance, knowing I'm 2 years away from Medicare, and finally, for the first time since 1984, can breathe with a sigh of relief. I can get a pacemaker. and the wires to my pacemaker are now 33 years old, and they've gone many years past their expectancy. And that's a whole day on an operating table because they have to laser them out to put new ones. It's amazing when you get into healthcare situations.
Let's thank our panel. I'm sorry, our time is up. Thank you all very much for sharing your stories.